Welcome back to Health Bulletin. In today's insightful episode, we delve into the first human case of a new swine flu variant. A person in the UK has been detected with a new type of influenza, resembling a strain of swine flu found in pigs, marking the first such case in the country, as reported by the UK Health Security Agency. In an announcement on Monday, the UK Health Security Agency said that a single confirmed case of influenza A H1N2 was reported. H1N2 is similar to influenza viruses that are circulating in pigs in the UK. The patient who was identified had experienced a mild illness and has fully recovered. The source of their infection has not yet been ascertained and remains under investigation. The UKHSA and other organizations are closely monitoring the contacts of the single case. These contacts will receive testing as needed and will be guided on further care if they exhibit symptoms or test positive. People with any respiratory symptoms should continue to follow the existing guideline. This includes avoiding contact with others while symptoms are present, particularly if the people they are coming into contact with are elderly or have existing medical conditions. The mode of transmission of how the individual contracted the virus remains unknown, as does whether they had any contact with pigs. This is the first detection of the specific H1N2 virus strain, designated as 1B1.1 in humans, according to a statement by an official from the UK Health Agency. However, it is very similar to viruses that have been detected in pigs. Health officials are diligently tracking close contacts to minimize further transmission, said a health representative. Following standard procedures, investigations are currently being conducted to determine the source of the individual's infection and to identify any potentially related cases. Cases of H1N2 among people are rare. Only a few dozen cases have been reported over the past 2 decades or so, and even fewer have been reported in the United States. To date, the United States has only reported sporadic human infections caused by Influenza A, H3N2, H1N1, and H1N2 variant viruses, with no evidence of sustained human-to-human transmission, according to the World Health Organization. An infectious disease researcher from the Johns Hopkins Center for Health informed Fortune magazine that the United States reports hundreds of swine flu cases annually, predominantly among people who work with pigs and those who visit agricultural fairs. Most of these viruses do not have the capacity to spread between humans, so it will be important to understand the transmission chain that led to the human's infection, including if that human had any exposure to pigs. In 2009, the UKHSA stated that an outbreak of swine flu in humans was caused by the Influenza A H1N1 PDM09 virus. This virus contained genetic material from viruses previously affecting pigs, humans, and birds over recent decades. The Cleveland Clinic reported that the epidemic resulted in at least 150,000 deaths, with individuals under the age of 65 accounting for approximately 80% of these fatalities. At the time, the WHO declared a pandemic for that variant of swine flu, but it declared it over in August 2010. Influenza A H1N1 PDM09 is now circulating in humans seasonally and is no longer referred to as swine flu, the UK Health Agency statement said. It is distinct from the viruses currently circulating in pigs. Regarding influenza A H1N2V, there have been 50 human cases globally since 2005. However, none of these were linked to the 1111 strain identified by the UK Health Agency this week, according to the statement. Earlier this year, a teenager in Michigan was infected with influenza A/HEN2V, according to World Health Organization officials. According to the report, the case is under 18 years old with no comorbidities, resident in the state of Michigan, who developed respiratory illness on 29 July 2023. The patient exhibited symptoms including fever, cough, sore throat, muscle aches, headache, shortness of breath, diarrhea, nausea, dizziness, and lethargy, stated the UN Health Agency. Her swab and blood tests confirmed a positive result for influenza A virus on the same day.
Thanks for watching.